Welcome back, everyone, to part 17 of our 20-part dental coding masterclass series. In our last explainer, we wrapped up the complexities of Category I, covering all those diagnostic tests, vitality testing, and pre-diagnostic screenings. Today, we're shifting gears completely and diving directly into CDT Category II, which covers preventative services. Look, preventive care is literally the heartbeat of any thriving dental practice. Mastering the billing for these procedures is absolutely crucial for your revenue cycle. So let's just dive right in.
Here is a quick look at our agenda. In this explainer, we're going to build a clear mental map of 3 key areas. First up, the prophylaxis and its strict age guidelines. Second, topical fluoride modalities. And third, the exact documentation you need for oral hygiene instructions.
All right, Section 1. Let's talk about the dental prophylaxis, specifically focusing on adult versus child codes. Okay, before we even think about choosing a code, we have to look at what's actually happening in the chair. Clinically, a prophylaxis is a professional dental cleaning that inherently encompasses both scaling and polishing to remove plaque, calculus, tartar, and stains. The entire goal here is preventing cavities and periodontal breakdown. Now, this is important. If the provider's notes don't reflect both scaling and polishing, you really can't bill this. But assuming they do, you basically have 2 primary codes to choose from. The CDT guidelines make this distinction incredibly black and white based on age. You're going to bill code D1110, that's the adult prophylaxis, for patients who are exactly 14 and older. Conversely, you'll use D1120, the child prophylaxis, strictly for your pediatric patients age 13 and younger. It seems totally foolproof, right? 14 gets the adult code, 13 gets the child code. Actually, hold on a second. There's a massive exception to this rule. As you know, medical and dental coding is just full of exceptions, and you must commit this golden rule to memory to avoid denied claims. Here it is. If a pediatric patient presents with a fully erupted permanent dentition, meaning all those baby teeth are gone, you must code the adult cleaning D1110, regardless of their biological age. Even if they're just 11 or 12 years old, D1110 is the correct code. So, always audit the clinical notes for dentition status before you just blindly bill based on a date of birth. Moving right along to Section 2, topical fluoride delivery modalities. Now, before we jump into the specific fluoride codes, let's address a huge question that trips up seasoned coders and billing aspirants alike. Can you bill routine cleanings and fluoride treatments to standard medical insurance? The strict, undeniable answer is no. Routine cleanings absolutely lack medical crosscodes and should not be billed to standard medical plans. Furthermore, keep in mind that fluoride treatments must always be billed separately from the prophylaxis itself. Even if the hygienist does the cleaning and applies the fluoride in the exact same sitting, they are 2 distinct services requiring 2 distinct claims. So what are we actually billing for here? Well, clinically, fluoride strengthens enamel against demineralization. It comes in active chemical forms like sodium fluoride, monofluorophosphate, or stannous fluoride. But here's the real secret for us coders. The chemical doesn't dictate the code. The delivery modality does. Whether it's a rinse, a gel, a foam, or a varnish, understanding the physical form of the fluoride is the absolute key to getting paid. You need to separate these services in your mind into 2 very distinct buckets. D1206 is your varnish code. Use it exclusively for topical application of fluoride varnish, which is typically painted onto all teeth for patients at moderate to high risk of caries. On the flip side, D1208 covers, well, everything else. Use it for non-varnish modalities like prescription gels, foams, or clinical rinses. Never mix these up. Varnish is always 1206 and everything else is 1208. Let's hit Section 3, Oral Hygiene Instructions, or OHI. Code D1330 is specifically for oral hygiene instructions. But here is the catch, and it's a big one. Handing a patient a free toothbrush and casually saying, hey, make sure you floss on their way out the door, that absolutely does not count. This code is reserved for dedicated, one-on-one, individualized instruction for home care provided directly by the dental professional. We're talking about a targeted, focused educational intervention tailored to that specific patient's needs. Because it's a dedicated service, your documentation literally has to be bulletproof to support billing D1330. Your clinical notes must detail exactly what was taught. Did they go over specific modified brushing techniques, precise flossing mechanics, dietary advice, or maybe the use of adjunctive aids like interdental brushes or specific rinses? Remember the golden rule: if it isn't documented, it didn't happen. Fortunately, D1330 is perfectly designed to be co-billed. You can confidently report it alongside adult or child cleanings, as well as diagnostic evaluations and x-rays.
What a session. Let's do a really quick recap to solidify this. First, always verify age and dentition for prophy codes. 14 is the standard adult threshold, but a fully permanent dentition totally overrides that biological age. Second, strictly separate your fluoride. D1206 is for varnish, D1201 is for everything else. And finally, ensure detailed, robust documentation for any one-on-one hygiene instruction if you're billing D1330. Master these three areas and your preventive coding is going to be flawless.
But we are not quite done with Category 2 yet. Join us right back here in Part 18 as we continue through the Preventative Services section. We're going to uncover the rules for pit and fissure sealants, dive into caries-arresting medicaments like silver-diamine fluoride, and tackle the complex world of space maintainers. You definitely won't want to miss that one.
As we wrap up today, I want to thank you for your dedication to mastering this craft. But before you go, ask yourself, how much revenue is your practice leaving on the table or putting at massive audit risk simply by mixing up a varnish code with a gel? Really think about it. Be sure to like, subscribe, and share this playlist with your colleagues. Keep learning, keep asking questions, and as always, decode healthcare with Harshal.